Hey everyone, I'm Stuart Akerman, MD. I'm a board certified gastroenterologist here in Dallas, Texas. And today I'm going to have a conversation with Alana Kessler about irritable bowel syndrome. Alana is a multi-talented individual. She is a registered dietitian, functional nutritionist, expert yoga and mindfulness leader. And she is the founder at wellness lifestyle brand Be Well by Alana Kessler. Alana, thanks so much for having this conversation with me.
Hi, Stu. Thanks so much for having me.
So when I was researching for this interview, I found that there was altogether way too much information between all the medical, behavioral, nutritional publications. Our focus today is really going to be more to discuss the whys and hows of irritable bowel syndrome and some interesting options that might be available to our patients for their treatment approach.
Mhm.
And when it comes to IBS, I think one of the most important things that we need to keep in mind is that there's no one size fits all approach to treatment in patients.
Right, for sure.
So, Alana, how would you define IBS when you have patients who come to see you, either in the yoga studio or as a nutritionist? What do you use as your definition of irritable bowel?
Um, well, irritable bowel syndrome is an umbrella term, I feel like, for a lot of different gastro and gastroenterological issues. I think when people don't quite have irritable bowel disease or something that's more of a clinical, straightforward diagnosis, it's called irritable bowel syndrome. So I feel it's a collective of symptoms like um, discomfort after going to the bathroom, unpredictable bowel habits, mucus in the stool, um, you know, constipation, maybe feeling like you haven't quite completed going to the bathroom, or maybe urgency, and also just general bloating and gas and just like discomfort. And then I think, it overlaps into thinking about it all the time, so it's almost like what comes first, the chicken or the egg with irritable bowel syndrome. And that really is a main factor of when I think about how to treat patients and clients that have, that come in and say, my doctor told me I have irritable bowel syndrome. Can you help me? And that's all right. That's how I go with it.
Yeah, on the medical side, it's actually quite similar,
Hmm.
and it's very very much like you described, right? It's what we call sometimes a rule out diagnosis, right? There's no special test that will diagnose you. You can't go to a lab and get a blood test that says, "Oh, you have IBS." It's
Hmm.
more that if you don't have any alarm symptoms and you've ruled out the testing for everything else, that you're
Hmm.
sort of left with this idea of irritable bowel syndrome, and it can be really frustrating to people because they know they don't feel well. And like you said, right, bloating in particular is one of the hallmarks of the syndrome. And to try to help out with that rather than have this frustration on the part of providers and patients, they created a collective called the Rome criteria, which helps to try to define patients or help you with a checklist of symptoms that if you meet enough of them, you probably carry a diagnosis. So at least then mentally, you know what exactly is going on with you, and you can try to
Hmm.
find the right solution. But
Yeah.
it's like you alluded to, it's really a multifactorial issue, right? I mean, there's a lot of different symptoms that could be interplaying. And I know we've discussed previously that there's a lot of possible genetic and epigenetic factors, stress related, right? Like if it's
Yeah.
bothering you, you're going to bother it.
Yeah. So, I mean, I want to kind of go back just to what you said before, just for a second. Um, the irony of that I find being a dietitian, so I am in the medical sphere. I'm a clinician, and I'm also a functional nutritionist, and I have a certification in Ayurveda, which is I'm an Eastern practitioner as well. So the Eastern and the Western to me is really interesting. I think that's what I believe that's what makes me unique in the field, is I do see things, like you said, from a clinical perspective and also outcome oriented with, the lists and the diagnoses. But I also understand that for someone who has irritable bowel syndrome, that actually can be more, that can actually be feeding the irritable bowel syndrome. The labeling, kind of giving you a label of a symptom and kind of saying, this is what I have, ironically takes people away from the feelings that they need to process to heal from irritable bowel syndrome. Irritable bowel syndrome, in my opinion, is a disease of the heart. And it's about unprocessed emotions, and therefore your stomach and your intestines start to, begin to give you feedback based off of the inability to integrate and process life and emotions. And so when you talk about epigenetics and genetics, like any kind of autoimmune style, something that triggers your system to be inflammatory and give you feedback, certain people's genetics and epigenetics get triggered, and based off of certain, based on certain stimuli. And some people's genetics is irritable bowel syndrome. Some people's genetics is, multiple sclerosis. Some people's genetics are different things that are going to cause inflammation. And so it really is about looking at the whole person, and taking into consideration the stimuli, the circumstance, the environment, the level of awareness and capacity to process not just food. And one of the things that I find when I get referred clients by doctors, for irritable bowel syndrome, is it's very food oriented. And, depending on your ability to absorb the nutrients, even if you have a restricted diet, like a FODMAP diet, which I feel like is something that people come to me with and they say, my doctor said I should be on a FODMAP diet. And I'm like, okay, but you know what? That might not be great for you if you have a food sensitivity to something in the FODMAP diet, and
Right.
it's not a one diet fits all thing. So
Plus, it's probably not a doctor who's actually done a FODMAP diet themselves.
yeah, so it's exactly, and it's just like, it's not, I think one of the things about irritable bowel syndrome is people are trying to treat, or they're trying to treat a fluid disease a fluid syndrome that doesn't have these kind of, A to B to C outcome. And they're trying to do that. They're trying to be like, well, you have this, do this. And it's really not that. It's really, who are you? What's going on? What's your life like? What's your history? What was your childhood like? How did you process this trauma? Have you taken antibiotics? Do you sleep okay? Are you happy in your relationship? Are you happy in your home life? What's your purpose? It's like all these
Right.
things. Are you living that way? All these things that kind of get into, the brain and and I know we'll talk about this, but affect your gut, and actually impact your microbiome and actually impact the bacteria in your gut, which effectively affects your entire cellular experience. So.
Right. I agree. I mean, I think this is why it's such a large swath of people who are affected by this, and why it's the focus of all kinds of different sectors: pharmacological, behavioral, nutritional, because there's no magic bullet, right? There's no one right way to treat this. And part of it is because it's different in every person, and also because every person is different in the way that they express it.
Yeah, exactly. It's really, when I hear somebody comes with irritable bowel syndrome, I'm like, a lot of the things, I do take a diet intake, but mostly I like to have a conversation with them, and I like to hear not just what they say, but how they're saying it. I learn so much about somebody, not just by what they're telling me, but by their energy in which they're telling me the information. I can feel, because that's kind of, again, for me, a lot of this healing work that I do with nutrition and yoga and mindfulness is about the feeling body. And I can feel, the tension. I can feel that they're holding their breath. I can feel, the analysis in the brain, and the trying to be like, well, this will fix this and it will become this. And it's just kind of about acceptance and just feeling into the sensations in the body. Like, I'll be like, well, what does it feel like, irritable bowel syndrome? And they're like, I don't know, I just want it to go away.
That's
And I'm like,
a
well,
very common thought.
yeah. I'm like, well, I think we need to actually like, turn towards maybe that a little bit. And, it might be that the way out and the way out is through, and the way out might be different than you thought.
That's
So,
great. I know we didn't collaborate ahead of time on which studies to discuss, and one of them encapsulates this perfectly. So
hmm,
we'll get to that in a few minutes, and that's great. I really like your approach. I mean, it really
thank
individualizes and makes everyone unique in the way that they're treated.
yeah, exactly.
So I want to try to break this down into three parts because I mean we could sit here for hours talking about this.
Right.
I want to focus on stress. I want to
Hmm.
focus on this buzzword that you see in the lay press a lot when it comes to IBS called gut dysbiosis.
Hmm.
And then I want to spend a few minutes discussing specific therapeutic options and things that maybe viewers can start thinking about themselves as to what may make the most sense for them. And
Sure.
kind of be able to go back, to see you or to see someone that they're seeing and discuss different options, maybe something that wasn't brought up to them before that may make a lot of sense for them. So can you talk a little bit about the role of stress in relation to inflammation? How would you define that interplay between stress and inflammation, and how in particular it relates to irritable bowel syndrome?
Yeah, that is a large question.
Feel free to tighten it up.
Yeah, so I mean there's a nerve, right? There's a vagus nerve that connects the gut and the brain. And that nerve is very important when it comes to either the brain or the gut basically course correcting for whatever's going on, right? So when it comes to stress can either be external or stress can be internal. So again, if you think about your personality, if you think about your environment, right? Some people are more heady. Some people have more predilection towards anxiety. And that anxiety is going to be very concentrated in the brain, and that's going to cause the brain to release, fight or flight hormones, which will then cause the body chronically over time. So adrenaline over time, adrenaline in short term is good, but over time, a fight or flight response is going to basically create an imbalance in cortisol levels.
Right.
And essentially will then can create an imbalance in insulin, which then eventually can create like this dysbiosis in the gut of how the cells and how the microbiome actually starts to absorb nutrients, right? So that's kind of just like a more basic understanding.
Right.
But when that happens, that essentially is inflammation.
Okay, so you're saying that it's good in the short term, but long term it can become almost maladaptive, right? Like that it sort
Exactly.
of messes up the equilibrium. And I guess just to define dysbiosis, we have a certain amount, right, that's considered normal or average
Yeah,
of
the
the
flora.
bacteria.
Yeah,
Hmm.
the flora in the gut. Basically, there's normal amount, and then if there's too much stress, whether it's short term, short term stress will do the same thing, but long term stress over time will create this chronic dysbiosis, which then can affect the permeability of the villi of the intestine.
Right, so more of a almost like an imbalance in the appropriate
Mhm.
bacteria.
Correct. And then the villi, which absorb the nutrients and then go into the bloodstream, right? So and then help to create balance and homeostasis in the body relating to nutrition and have the organs working well and have the emotions being well too. Um, you'll start to get these food sensitivities potentially based on foods that you eat a lot, right? Because the villi will start to be more permeable, so the body will create the body will create antibodies against these foods you eat normally, right? So it's not that you're allergic to these foods, but because there's this inflammation, right?
Right. So I would sort of echo that and say that out loud, that there's a difference between sensitivity and allergy.
Correct. Yes. Big sensitivity. Yeah. Sorry. Big difference. Yeah.
Right.
Big difference between
It could be big
sensitivity.
sensitivity too. Right.
Yeah. Yeah. Big difference between a food sensitivity. A food sensitivity is usually an inflammatory response against something that you typically eat a lot
Mhm.
of if your gut is in dysbiosis, right?
Right.
So basically then you would do an elimination diet, which is something that I do, and I actually have just completed an ebook, 21-day elimination diet, that I'll be offering soon.
That's great.
um yeah,
Where can people find that?
they will be able to find that on my website. Yes, so I'm
And
very
how
excited.
do you spell your website?
BeWellByAK.com.
Great.
Yeah, it's just self-guided. It's really comprehensive. Of course, I'm available for individual consults if people need extra support, but I really take you through how to um, reintroduce foods back in, and what happens if you have symptoms or responses again. So anyway, but speaking of sensitivities and allergies, then you would remove those foods, but it doesn't mean you're necessarily allergic to them.
Yeah, this is
Remove the first
fascinating stuff to
characteristic.
me. I find that the interplay is so dynamic, and we know a lot. It's one of those things where we know that as much as we know there's so much that we don't know, and it really opens up the ability to do research into these areas a lot further. I found something super interesting when I was doing a literature search on this. There's the concept of this brain gut microbiome and the brain gut axis, this
Mhm.
bidirectional communication between the gut, is well played out. I mean, this is something that's fleshed out in the literature. I mean, you could just Google it and get a ton of literature across the spectrum about it. But there's not a lot of data in actual human interaction. In other words, seeing what happens with changes in the gut and how that actually interplays with the brain. There was a study done last year
Mhm.
in clinical gastroenterology and hepatology where they did a literature review to look at all this and really had to pare it down because where they thought they had tons and tons of data, it really didn't pan out as far as true human studies. But they specifically were trying to focus on this bidirectional communication that involves neural, endocrine, and inflammatory mechanisms, like you had just mentioned.
Mhm.
And communication can be modulated by variations in the permeability, like you were just touching on, that if you get that inflammation and the villi start changing and things can sort of pass through easier, that will then affect starting in the intestinal wall, but then may affect the blood-brain barrier. I think the best example of this is that turkey coma that you get on Thanksgiving, right?
Mhm.
Because we all know, we hear about this word tryptophan, right? So eating the turkey allows the tryptophan to cross over. It's coming from your gut, but then it's affecting you in your head, right? It gives you that fatigue.
Yeah, and also I believe the brain makes its own tryptophan as
Yeah,
well.
it's a stimulus. Yeah, stimulus
So
response.
yeah, so actually serotonin, 90% of your serotonin is in your gut, which is something that you want to activate, because that actually creates the rest and digest. That's calming. You want to actually create serotonin, and tryptophan is a precursor for serotonin. So foods that are high in tryptophan, you actually do want to eat. Because for the most part, unless you have some sort of trauma, in which case it will go in another direction, which is another conversation, tryptophan will be converted to serotonin. Um, but in Thanksgiving, we just overdo it. And therefore
Yeah,
it's like,
which doesn't help.
that actually is a really good kind of interesting thing to think about with IBS, because IBS really is an imbalanced syndrome, right? So it's like turkey's not bad. It's just on Thanksgiving we overdo it.
Right.
It's like irritable bowel syndrome is almost like a messenger that's saying you're overdoing it. And usually the overdoing it is mental, like it's stress. It's like I'm taking on too much. I've ignored my emotions. I've ignored the inner voice that's saying relax. The voice that's taking over is like, I need to do more, I need to be more, I need to consume more, I need to produce more, like, you know and then you get all these other syndromes, because of the blood-brain barrier. Studies recently, and things that I've read, and articles and papers that I've written, also Alzheimer's now is being shown to be a disease that's, based in, diet has a huge factor, and so does this whole kind of endocrine, neuro, nervous system, uh, collaboration, so to speak.
Right.
Yeah,
Yeah. And one thing I learned and did not know as I was reading through this article is that gut microbiome interactions are actually programmed during the first 3 years of life.
correct.
And I never learned that in medical school. And I found that to be really interesting, because a lot of patients will tell me how, this has been lifelong, or I've always had these issues since I was a kid. And, a lot of times you kind of wonder, well, did you, was it overly stressful for you? Were your stimuli maladaptive when you were growing up? And, it turns out it may be that they're sort of preconditioned because that's the way they were set up.
Well, that's what I was saying about when I meet with clients. I usually ask about their childhood. I usually ask if they were breastfed. I usually ask if their home environment when they were a baby was, was calm, or was it volatile? Even if it wasn't intentional, right? It doesn't mean you have to have like an abusive parent. It just means that
Right.
as a baby, if you are, you're a doctor. Like if I know my dad's a surgeon. He was never home. It was like he was working so hard for us, so that we could have a great life, and so everyone could have a great life. But as a baby, all you know is that, you know, your
He's not
mom is
around.
stressed out and your dad's not
Right.
around. It's like, and of course, you're a human, but as babies, we don't have a prefrontal cortex. We don't even develop that till we're 25 years old. So
Right.
it's like, it's not even just babies. And then we're just compounding upon this, 1 to 3 years, which is why when you talk about attachment theory and psychology, oftentimes that's brought up, and I know it's sometimes very sensitive. You have 3 kids. I don't have kids, but I study a lot about this, and parents can get very sensitive when you bring up attachment theory with parents, when you have adults or young adults, or even people that are willing to acknowledge that maybe there is a correlation
Hmm.
between you know these things. And it is true. And I think irritable bowel syndrome is almost like this opportunity for us to see that everything is connected, and instead of trying to figure out how to make it A, B, C, we can finally just say like, oh, this is an opportunity to be like, it's not, actually. And it is very, it is very multifaceted. And let's not try to compartmentalize it. Maybe we need to integrate more,
Right.
not, and not feel blame or ashamed so much. And that's really where the mindfulness piece comes in. I think, that's really the foundation of mindfulness, is really to be able to, from a little bit of a detached place, be able to feel your feelings without blame or shame, and reintegrate them back with forgiveness and understanding, and using your higher intelligence from a wisdom place as an adult, be able to reprocess things that might be true, but they don't have to be, there don't have to be blame about it.
Right. And I think that's a big theme a lot of times for people, that there's this sort of internalization
Yeah,
that is misplaced.
yeah. But it has to be spoken about. And I
Right.
think people feel ashamed to even say like, yeah, I did feel very unsafe in my home environment when I was 7, or when I was 5. And it, because they feel guilty, almost like they're blaming, but they're not. It's like, your experience doesn't have to mean that someone did something wrong. It just
Right.
means it's your experience. And I think as a humans, and as a culture, we need to start to see that. And that's really the essence of mindfulness, is really to start to be like, oh wow, I see your experience. It doesn't have to be about me.
Right.
but I'm going to hold space for you and your feelings. And that's what we have to do with our irritable bowel syndrome,
Right.
right? Instead of just saying like, go away or you're not right. You know, our irritable bowel syndrome symptoms are basically saying like, stop telling me that I'm wrong.
Right. Yeah, it
Yeah,
has to be acknowledged in order to be able to defeat it.
exactly. Yeah.
So let's shift gears just a little bit.
Yeah.
We started talking a little bit about gut dysbiosis before, and we started sort of defining it. But can you put out there a more sort of clear cut way that you would define gut dysbiosis?
Yes. So gut dysbiosis is changes in the flora of the gut, leading to increased permeability in the villi. It can lead to food sensitivities and chronic dysbiosis, which can lead to lowered immunity, secondary to inflammation, based off of the cytokines that get released over and over again um, due to that, again, that vagus nerve
Mhm.
brain gut axis, essentially just continuing to get stimulated over time, and then it loses its, and then it gets dysregulated.
Right. So this is a big focus of research for treatments because this becomes a large target for therapy in irritable bowel syndrome. Right. If you can make the assumption that a lot of the inflammation is starting out by changes in permeability in the gut, then if you can somehow alter that permeability, maybe tighten up the junctions, maybe decrease the inflammation, stands
Mhm.
to reason that you'd be able to, successfully treat a lot of the symptoms. And
Correct.
there's different ways to do that: to direct immunity related therapies,
Yep.
probiotics, prebiotics, all kinds of herbal remedies.
Mhm.
Are there any kind of specific recommendations or treatments, whether they be medical or naturopathic herbal, that you like to start out on people when they come to see you?
Oh yeah, I have a many.
Okay.
um, so
I
I
don't want to
usually
give away all the trade secrets at once.
I usually people on probiotics. L-glutamine is one of the big things that I have people on. Depending on the severity, sometimes if IBS was triggered by a trauma, like a direct trauma, maybe like food poisoning or something like that, I usually put people on butyrate.
Mhm.
Um, I find that to be helpful because of the branched chain amino acids.
Right. Branched chain amino acids, just to sort of say that out loud,
Mhm.
um, can affect the blood-brain barrier. So they sort of have a dual benefit.
Yeah, exactly. Lowering fiber, actually. It's actually a lower fiber diet, which is maybe sometimes, usually we recommend like 25 to 30 grams of fiber a day. I would recommend a 15 grams of fiber a day.
So
So,
let's talk about that, because I think that's where we're going to disagree just a little bit. I'm
yeah.
curious. So why a low fiber diet?
Um, well, just because sometimes, well, okay, so I'm actually gonna,
Well,
I'm,
I should also preface this with, does it make a difference? So we didn't mention this earlier, but there actually are three subsets of irritable bowel syndrome, right? You got your diarrhea predominant patients, your constipation predominant patients, and
yeah,
then the ones that are mixed and
yeah,
alternating, right? The ones that have diarrhea and then all of a sudden they flip over to constipation and vice versa.
yeah.
So
Mhm.
when you say a low fiber diet, is that IBS in total or a specific subset of patients?
Okay, so I'm actually going to amend what I
Okay,
said.
fair.
So, low fiber diet is not necessarily, that's not a recommendation that I'll necessarily make
Hmm.
directly, right? But what I will say is, I actually would say limit raw food.
Okay.
So I would say limit raw vegetables and crunchy things.
Yeah, and actually that I totally agree with,
Yeah.
because there's this really difficult paradigm that I see when I'm treating patients with irritable bowel, because on the one hand, I want them to eat more fiber to get
Mhm.
better bowel regularity. But on the other hand, they tend to be by and large very sensitive to fiber, in particular these raw vegetables that
Correct.
make them very gassy and bloated and uncomfortable. So
Correct.
you want them to have fiber, but then
Yeah.
it's bothering them like crazy.
Right. So typically like my initial intervention, depending on the person, would be like low fiber, right? Because a
Hmm.
lot of times people come to me in New York City, they eat like sweet green salads and it's just like crazy.
Right.
And to try to get them to change their food, the way they prepare their food and manage the symptoms is challenging. So like I will start with that, right? Sometimes.
Hmm.
But the main intervention is decrease in raw vegetables, which in general, that's actually across the board. My recommendation for people is to have only two-thirds warm vegetables and one-third raw.
Hmm.
And to get, and I also like to explain the difference between non-starchy and starchy vegetables, because I find that with irritable bowel syndrome, starchy vegetables can be really helpful, and also baked fruits, right? So having fruit but baking them and cooking
Hmm.
them, because fruit raw can be also hard on the belly. Though berries have been shown to help with diarrhea, to help with constipation.
Hmm.
Again, it's very individualized. But the limiting food that's going to create air, right? That if you think about it, it's airy. So
Right.
this is where I bring in my Ayurveda practice, because in Ayurveda we have elements of air, fire, earth, and water.
Hmm.
And when you think about it, IBS is an imbalance in the air, right? It's an imbalance in all of them, because stool is earth.
Right.
But when you have an air imbalance and the fire is actually in the brain, right? So the fire is the overthinking and the whole thing. You basically end up burning the earth with your fire and you get more air, right? And that's what IBS is, right? Or you end up creating too much water, and that's diarrhea, right? So constipation is too much air, and basically having too much water is diarrhea, and it's just this
Right.
imbalance, and depending on your constitution, it's the person. So I typically like to have more water, right? So more liquids, less
Hmm.
air. So anything that's going to cause air, crunchy foods, raw vegetables, anything raw, I'm like, no. And then everyone needs to have more fluids, so that's like my baseline.
I think that's great. And it's funny. I'll throw into the mix there. I often tell my patients not to chew gum for the same
Mm-hmm.
reason, because I'm worried about them swallowing a lot of air and creating more, gas distension,
Yeah, or bubbles, like,
carbonation.
seltzer.
Right.
Exactly. A lot of times people will come in with IBS, and once they get into their food diary, they're like, I have, you know, Pellegrino
Right.
every day. And I'm like, okay, well, maybe we'll cut that out, and they're like, but shouldn't I do FODMAPs? I'm like, why don't we cut out the Pellegrino? Let's see how that goes.
Right.
Cut out the raw vegetables, the Pellegrino, and, cook yourself warm vegetables and have bone broth, and let's see how that goes. And they're
Right.
like, but I'm supposed to do all these elimination things and, deprivation, and I'm not supposed to have this. And I'm like, is that making you more or less anxious? And they're
Right.
like, more anxious. And I'm just like, okay, so let's not do that.
Right.
And people have a big resistance to letting go of these kind of, quick fix things that people tell them are going to make them better, that get them nowhere. So
Right.
for me, that's, my big push in the industry, is to really be like, it's really about simplicity, and it's really about intuitiveness, like what's intuitive to you, and thinking about things in a holistic way.
Right. And that's why I love doing interviews like this, because, it helps my viewers and it helps patients sort of cut through the noise, right? Because you get preconditioned sometimes, you walk into an office, to see a nutritionist or to see someone who deals with well-being, or a doctor, and you've Googled it all, right? So not to say it's bad to have information, but it's really hard sometimes to parse out what's good and what's bad, and what's sort of misleading you, and getting you down to sort of the wrong path for you. And conversations like this help to cut through the noise, and I think that's really helpful.
Yeah, I mean, ultimately, I think, because like you said, there's so much Google, there's so much information. At the end of the day, I think what that's telling us is people know, in a deep intuitive place, that what's going to heal them is to be seen. They just want to be seen. They want someone to put the pieces together of their life for
Hmm.
them. They want someone to say, like, yes, your life your life did cause some struggle. Your life was hard, even though it wasn't hard in relation to people, living on the streets, or, things like that. For you
Right.
it was, and that matters, and that's important. And no one's ever told you that. No one's ever made that important. And you'd be shocked at the people, after we have these conversations, 3 weeks maybe even less. People are like, I don't have symptoms anymore. Yeah, and I give them
Right.
the recommendations, the glutamine, the probiotics. I like to give people aloe vera as well, is one of the things that I like to give people half a cup 3 times a day.
Yeah.
It tastes bad, so you might want to put it, you might want to bring it with something else.
Yeah, but there's a
Um,
lot of good data supporting how aloe vera
mhm.
has positive effects on the gut and intestinal permeability.
Totally. And for acid reflux, sometimes people can get acid reflux as
Yeah.
well, like with IBS. Magnesium, huge, is really huge. Magnesium glycinate, really huge. Um, yeah, I mean, and peppermint. I love peppermint oil. Great. So you can actually, I do have a link to where I send people to get peppermint oil. If people are interested, they'd have to just get it through me. But to me, I take peppermint oil daily because I actually used to struggle with IBS for many years. I haven't struggled with any symptoms of IBS for over a decade. However, when I'm stressed, like now, so, we're in the middle of the coronavirus pandemic. So, um, when I start to get symptoms of IBS, where I'm at now in my life, I'm like, I'm super stressed, like I'm overstressed. And I start to, do my other, I don't actually go to the food immediately. I immediately go to breath work, and I immediately go to yoga that's like calming and more
Hmm.
intentional breathing. So the goal of yoga and meditation is is really about breath and about regulating your nervous system. In traditional Chinese medicine, the lungs and the large intestine are a yin yang pair. The lungs is the yin and the large intestine is the yang. Yin organs absorb energy and yang organs move things down and out. So if you're not breathing well, you are going to have irritable bowel syndrome,
Right.
right? By nature of this traditional Chinese medicine theory. So actually, a lot of times, just breath work, right? If you're holding your breath and you're doing yoga, it's going to make it worse because you're creating, and you're doing active yoga because it's more fire, it's more activity,
Hmm.
and you're not breathing, right? So you're going to get more stuck. Or if, and the earth is going to get more compacted. Or if you have the other way, you're going to get diarrhea, right? If your constitution is more watery, right, you're gonna get diarrhea. So really breath work is, key. And when you're meditating, breath, focusing on the breath, doing breath work while you're meditating, like inhaling through your nose for 5 counts and exhaling through your mouth with pursed lips for 10 counts. Or if that's too much, like, 2 and 4, 4 and 8, 3 and 6, it's really about the breathing more than anything else.
That's really cool. I
Yeah.
mean, let's start talking about some of the specific therapies. So, we talked a lot about how stress reduction is a key component towards successfully combating IBS. I read a really cool article that looked at mindfulness-based stress reduction as a formal therapy and
Mhm.
how it improves IBS. And this was great because they took a whole bunch of people. So they had I think about 60 something, 68 patients who all had diagnosis of IBS based on various either Rome criteria or self-reported questionnaire, and they put them in this intense 8-week mindfulness strategy program,
Mhm. What I read.
and they retested them. And they used this questionnaire essentially that created a numerical value for how active their symptoms were. So it was more of a objective way to measure how significant the IBS was and how it was affecting their quality of life, and all these parameters related not just to the IBS itself, but how it affected them sort of globally.
Sure.
And they retested them when they started. They tested them when they started, so they knew the baseline. They tested them when they were done at 8 weeks, and then they
Mhm.
tested it again 6 months later, right? Because in reality, if you do something and you're in the thick of it and you're feeling better, that's great. But how's that set you up as a platform for life following? Just like
Sure.
you just said, right? You haven't had symptoms in 10 years because you built the necessary steps to know when things were getting bad, how to jump into action to mitigate that.
I also get the triggers, right? So I actually, and I'm attuned, right? So this is really about attuning. It's like an instrument. You need to see your body as an instrument and you have to tune it, you know?
And that's
So,
exactly what they found, actually.
uh,
They found that by and large, this strategy helped, but where it really hit home, the people who developed insight, the ones
mhm,
who were able to be present in the moment and retain that focus and act with awareness to what was going
mhm,
on. Just like you said, right? They
yeah,
were able to isolate the trigger as it was happening and know that it was a trigger.
yep.
They were able to knock it out, and they were the ones who were the most successful in mitigating and getting rid of their symptoms.
Yes, but if you notice, it's not about not feeling the discomfort. You have to
Right.
be willing
It's
to turn
acknowledging it.
towards it. And you have to be willing. And it's the same thing that I said before. When we talked about, trauma or, looking back at your childhood, like you need to be willing to turn towards it with a certain level of dispassion, right? So detachment I find to be a challenging as someone who teaches meditation and mindfulness for, I don't know, almost 20 years. It's detachment can sometimes be something where people feel like I'm detached, which means that you're not where you're detached, meaning that you're almost dissociative, right? We don't
Right.
want dissociativeness. We want a dispassionate, which means that you're engaged, but you're not entangled,
Right.
that you're willing to look at, observe, almost take in with discernment and listen, and then say, thank you, and then offer gratitude. This is like, so gratitude practices isn't just for things that make us feel good. It's for messengers that come in that feel bad, that help us to, that lead us towards a greater insight, towards our higher purpose of feeling good.
Right.
But that those messengers don't always feel good immediately, but you have to be willing to say thank you anyway.
Right.
you know yeah.
Would it be fair to say that because innate trauma or processing of emotions are a key component, that for some people, working alongside a behavioral health provider might provide benefit in treatment of the disorder?
Oh, 100%. I mean, I do a lot of cognitive behavioral work, so when people come to me,
Hmm.
a lot of times that's included in my practice. So again, I'm not a traditional clinical dietitian. So my fees are higher because most of my appointments are an hour long, and it is kind of a combination of psychotherapeutic techniques. I'm not a psychotherapist, but a lot
Hmm.
of cognitive behavioral techniques with nutrition guidance, with all that stuff that goes along with being a dietitian, and plans and supplement plans and individualized customized plans. But if I do have a client that has a trauma, so for example, I've worked with people and then we've uncovered a trauma, right? Like sexual abuse or
Hmm.
an abuse or something that was a traumatic experience, then I will refer them to a psychologist.
Right. So
To deal
it's not happening in a vacuum.
Correct. Yeah. But I always 100% you have to blend, you have to blend the psychology and that therapeutic psychological healing with food.
Hmm.
Um, Otherwise you can change your food, but again, your cells are not going to adapt if you don't change, if you don't rewire your brain, if you don't have neuroplasticity essentially. And so the neuroplasticity research is huge in relation to IBS because we can actually rewire our neural pathways with mindfulness, but not consuming mindfulness, not consuming concepts. We actually have to be willing to take our lives and practice them with our lives and create, again, like I said, this sense of dispassionate interest,
Right.
and forgiveness and appreciation, and a willingness to engage with the content that arises. Yeah.
Right. Internalize and adapt.
Yeah. Yeah.
Right. So, in my practice, I get a lot of people coming in, and not for irritable bowel in particular, but in general, we're sort of conditioned that if you go to a doctor, you need a drug.
Mm-hmm.
And I get a lot of questions about that, like what drugs can we use for irritable bowel? And, I always like to tell people that it's not a disease. You alluded to this earlier. It's not a disease with a quick fix, right? There's no sort of one way to, there's no A to B to C, right? Which is where drugs are really helpful. You have an infection, you treat it with an antibiotic, right? You
Mhm.
don't have that here. So the goal of any kind of medical therapy is adjunctive to everything else that you're doing. It's there to help with the symptoms. And, there's all different kinds of stuff that we can give you, but ultimately they're just going to mask the problem. You still have to use that alongside trying to figure out, working through trauma, working with meditation, working with better bowel hygiene, in order to get to a better place. So you can use an antispasmodic medicine and it can help with a lot of that cramps. There's several good things for bloating. Like you mentioned, peppermint oil is fantastic. It's really helpful for gut inflammation and bloating. And you mentioned that you have a product. There's several other commercial products available like IBGuard and Atrantil, which I find
Mhm.
are really, really good for bloating as
Mhm.
well. And an interesting treatment modality that's come up, and it actually makes a lot of sense given our discussion about gut dysbiosis, is the idea of fecal transplant and
Mhm.
whether or not that can be a beneficial treatment for someone who sort of tried everything they can and they're just in the throes of symptoms and they can't kind of break free. And fecal transplant is the idea of transferring essentially or repopulating the
Mhm.
gut microbiome into a person from a healthy donor. And this
Mhm.
is this has been successfully utilized with a severe intestinal infection called C. difficile.
Mhm.
And there's tons of great literature on people who have recurrent or refractory C. diff, because the problem with refractory C. diff is not your ability to fight C. diff. It's that you don't have a good set gut flora. So we need to repopulate that for you. And we can help you by treating the C. diff and doing the fecal transplant. So the theory would it make sense to apply to IBS as well. And I found a great study because there were two small studies done that had a little bit of conflicting data, so you couldn't really do too much with it. But there was a really great study last year in the journal Gut, where they took almost 150 people and they split them into three groups. So you
Mhm.
had your control, where those people were given their own stool back, but blinded, right? So it's a randomized trial. They don't
Mhm.
know, no one knows what they're getting. So, you sort of have to just say how you feel afterwards.
Right.
People who got the standard dose of transplanted stool that we use typically for C. difficile, and people who got a double dose. So
Mm.
when there's different ways that you could do fecal transplant, but one way to do it is to actually get an endoscopy. So when you're sleeping, you go all the way down into the small intestine and you put all the stuff in there. So it's not
Okay.
something you really know about. It just kind of happens and it's 10 minutes long and it's safe and easy. So we usually use 30 grams of stool from a healthy donor.
Mm.
These people, some had 30, some had 60. And what they found was 23% of people who had placebo did better. And I'll come back to that in 1 second.
Yeah.
76% of people who had the standard dose felt better at 3 months, right? So
Okay.
again, waiting to see if it was a durable
Mhm.
response. 89% of people who had a high bacterial concentration, so a 60-gram dose, 89% felt better after 3 months,
Okay.
which makes this into a fascinating concept, sort of both as a therapy and also proving the idea that if you can somehow rejigger and fix gut dysbiosis,
Mhm.
that's going to break that vicious cycle.
Yeah, I mean, that's a really interesting study. I think it is. It's a combination I mean, it's almost like it sounds similar to like a stem cell type thing.
Yeah, almost. It's right. It's like
Yeah.
the gastroenterology equivalent of a stem cell
Yeah.
transplant. And to use that idea, right, when you did it, what's called autologous, meaning you give your own stem cells back. So you gave the people their own stool. Less than a quarter felt better, which proves, I think it tells me two things. It tells me that in general, something's wrong with that stool, right?
Yeah.
Something's wrong with that gut. So it can't function well.
Right.
I also find it very fascinating that about a quarter of people felt better just from the intervention. That
Right.
placebo effect is mental, right? It's
Mhm,
the
totally.
fact that you feel like you did something and
Yeah.
that you've helped yourself.
Yeah. which is why I think it's super interesting that 6 months later, that was the 6 months.
3 months in this study.
Right. So 3 months later, the ones that had the 60%, correct?
The 60
grams.
grams. Yeah.
Yeah, the one that had the 60 grams, 89% felt better, because that at that point, some of the placebo effect would have already potentially
Yeah.
left. And so it shows that there actually is a direct, correlation. And it's not just about, insights, which, I'm a huge proponent of insights and, all the mindfulness work, but it is a true combination of, the actual physiology and psychology together, and you need them both for sure. And that's an amazing study for sure.
Yeah. Yeah. I thought it was super interesting. I mean, there's practicalities and, FDA approvals and all that. So it's not as simple as everyone just sort of
Yeah.
running out and saying, let's go get a fecal transplant. But I think it lends a lot of weight to getting that discussion, in play. And I think there's probably going to be more data coming out, and I can't wait to see, because
Yeah.
we're looking for stuff to help these patients.
Yeah. I mean, for sure. I mean, symptoms are really challenging, for most people. I feel like, and being uncomfortable in your stomach. I mean,
Hmm.
that's really the root. There's so much there, and there's so much, it's about, that's where you have your confidence and your self-worth, and to not feel good there is really tough.
Yeah. So I could sit here and talk to you about this for hours, because
Right.
I find this fascinating, but I think at this point we should probably try to wrap up a little bit. And, I think as a general summary, I think we've proven that IBS requires a sort of a multimodal approach that's tailored to every individual. And, you can start with some basic ideas and maybe some trial and error, but ultimately everyone's going to be a little different in how they find success. If I was your IBS patient coming to you for my initial consultation,
Mhm.
what would you tell me your focus for building my plan is?
I mean, it would definitely be very, again, like I said, I don't have a plan in advance for anybody. So for me, it would be about listening to you and your story. But then for baseline, I usually put everybody on a probiotic, the aloe juice, my recommendations for, cutting out the dry, airy foods and switching to more warm cooked foods, um, educating people on nutrient density, making sure that people are getting enough vitamins and minerals. People that come in with diarrhea typically can be zinc deficient, so I usually recommend either a zinc supplement or foods that are higher in zinc. Um, and we talk about some journaling. We talk about just keeping a food journal and monitoring your emotions. I talk about, I like to see for a week how their eating style is. Eating small, frequent meals is really important, not skipping meals. When you skip meals and you let your digestive, you let your kind of digestive enzymes just stew, or the acid in your stomach stew, that can sometimes create IBS, and your metabolism slows down. And so eating small frequent meals is really helpful. Some people I put on digestive enzymes, that can be helpful for people, but really, again, it's individualized. And it really depends on what the person needs to make them feel safe and supported to get started. Even if I sometimes feel like that might not be what helps them, I always want to give people what they want, and what's going to make them feel safe to continue, and really get to the place where we can alleviate the discomfort and the symptoms, and have people less afraid of the symptoms too.
Excellent. And when I have patients who come see me for irritable bowel, typically I'll spend a longer session, a longer new patient visit, so I can get a pretty detailed history, because as you said, it could be coming from multiple different directions, and I want to try to get a sense of what the biggest issue to them is, how they perceive it, and maybe what I can pick up on as being triggers for them, whether that be nutritional, whether that be emotional, or others. I do focus a lot on bowel hygiene. Like I said, there is an issue with fiber. So I do try to get the patients to do a bit of a food diary to find out what foods in particular
Mhm.
may be bothering them. I'm a big fan of prebiotics because
Okay.
prebiotics will break down into both fiber and probiotics, sort of killing two birds with one stone. Unfortunately, there are some patients who, even with those, can find sensitivity. And if you're that person, that's okay. Like I said, it's individualized, and we figure that out. And I have a pretty short leash to involve other practitioners with me in the treatment of my patients because this is not something that I can necessarily fix on my own, right? It may be
Yeah.
that I treat some of the symptoms, I rule out some of the other diseases, and then I have someone like Alana come help out and help to explore some of the emotional irregularities that they have, get people back in balance. And between the two of us, or sometimes the three of us, involving a functional food physician or an immunologist, we try to get a better sense of the patient as a whole. And hopefully you found that this conversation was helpful. And if I really appreciate it, Alana. Thank you so much for spending the time with me. If you want to reach out to Alana, you can find out more information on her website at www.bewellbyak.com. You're currently offering online yoga sessions and nutritional counseling at this point, right?
Yes, yes, I am. Yeah,
Fantastic.
I will be, I don't know when this will be released, but I will be, I'm also going to be rolling out a subscription model for my coaching, an online subscription model, so people can, can join that, and of course work with me one-on-one as well. But that will be a really foundational way to understand your diet and build a foundational emotional and nutritional baseline for how to keep yourself healthy and well and enjoy food. And yeah, it's a beautiful program.
That's
Yeah.
great. And you can find more information on my website at www.stuartakermanmd.com, STUAKERMANMD.com, and follow my videos on YouTube and subscribe. Thank you so much, Alana.
Ah, thank you.